So what made you want to become a nurse?
You know, I think when I was born, I think I might have been born an asshole, honestly. I was just sort of a rebellious child. I had anger inside of me. I always wanted to break the rules and push the limits. And so, my teenage years were very we moved here from New Jersey when I was in my sophomore year of high school. And so, I didn't want to come. It was I was rebelled against that. And so I didn't go to school. My mom would drop me off and I wouldn't go to school. And so from having so many absences, they sent me to continuation school. And in continuation school, it's a lot of kids that are having problems and stuff. And so I dove right into drugs. And so in high school, I started using heroin. And, that kind of got me stuck for, until I was about 25 years old. And I kind of lived that life. And so, my parents, tried to help and send me to rehab and stuff. And I would go to detox and I would come out of detox and I would go right back to using usually. I had every good intention. I wanted, I thought that it was going to be the time that I was going to stop. This time is going to be the one. But it was just something would take over me and I couldn't, I would just go back every time. So they were okay, well, if that's what you want to do, then, we're not going to help you. And you have, you're on your own. So I started stripping. That's what I did to support myself. And, through those years, I was just not a good person. I was a liar. I was a cheater. I was always in your pocket for what you had. I made friends with people because of what they had, not because of who they were. I probably had zero self-awareness of how I affected other people. I really didn't care. I was very selfish. And that just after a while, when you start to gain some self-awareness, when you get a little bit older, it's kind of a lonely place to be when you're not a good person.
What is it about maturing that makes you realize the mistaken, the path that you're on is not right?
Well, I think, when I was younger, I thought that I was invincible. So I just thought nothing could touch me and I thought I was right and everybody else was wrong. I'm smart and you're stupid, kind of thing. And I really had to learn that I was wrong, kind of the hard way, So, I just, I don't, it's I just I'm sorry, what did you ask me again?
What is it about maturing that makes you see the error
okay.
in your thinking?
So as you get older, I feel you just kind of start to gain more self-awareness. I don't know if that's true for everybody, but for me it was. And I started to see that, people didn't really like me, and the things that I heard that were said about me weren't very good usually. So, that didn't feel good. And I started to kind of pay attention to that. And I was working in a strip club and this girl that I was really good friends with, she was actually going to school to be a nurse. She wasn't on drugs or anything like that. She was actually a legitimate, going to school, nursing school, stripping, to make her way through. And she was like, Rachel, why don't you just get on methadone and go take an EMT class or something? It's a job that you could get. It'll be easy. And I was and I was kind of tired of dancing. I was kind of tired of using at that point too. And I was I never thought of that. And so I did. I went and I got myself on methadone and I signed up for an EMT class and I took an EMT class and I started working as an EMT. And the craziest thing was that through taking care of other people, it started to make me feel like a good person. And I wanted more of that. And so I just, it was this dramatic change that happened through that, through caring for other people and seeing what that did for them, really kind of meant something to me. And I wasn't there for that. You know what I mean? I was there because I needed a job in the first place. And so I talk about that as kind of one of those magical moments that happened in my life that really was defining.
It's beautiful.
Yeah. And so I got a taste of that and I wanted more. And I decided that I started to have to really take a look at who I was and where I was going and where I came from and what I was going to be doing with my life. And I realized, I wasn't a good person. I was a dick. I was an asshole. And I treated people like shit. And that's why I got treated like shit in return. And so I really kind of dove head into what it meant to be a good human being. And I looked out for other people that I thought were good humans. And and I followed what they did. And then I started, it just kind of became a thing. And I remember the day that I finally felt I crossed the line into being a good person, So I was an EMT, and then, I loved that, and I wanted to, do more with that because, obviously I could barely put gas in my car with that job. You don't make a lot of money. So,
what age was it when you switched?
I started doing EMT when I was I went to EMT school when I was 26. So I was an EMT for 8 years, and then I have been a nurse for almost 7 years now. Yeah. So as I was working as an EMT, we used to work like day shift, which would 12 hours and 12-hour night shifts, and sometimes with 24-hour shifts and stuff. But you're not always working the whole time. There's a lot of like sitting and waiting for calls in between. So I started going to school and taking my prerequisites, and then I got into a nursing program. And I got went to nursing school to be a nurse because I wanted to do more of that, being a good person and taking care of other people, because I felt like I, had this history of like coming from a place where, I wasn't very good, but people didn't treat me very well, but I wanted to be able to treat people that weren't always in, maybe were suffering or had made some mistakes, like treat them like like a human being, like they deserve to be treated. Because I remember when I would go to the hospital, if I had like an abscess or something, and they don't really treat you very nice. Like, they may not give you lidocaine to numb that before they do, things like that. Like, and I understand, because they don't understand, they think that you did this to yourself, which you did in some way, yes, but it's like not that simple, So, I really get a lot. Now I feel like it's my purpose, like to be a nurse. Like, that's why I'm here, like on the planet. And that's why, like, I went through like all those experiences so that I could learn and get to the place where I am now, so I could be even better, like as a nurse, And so I love it. It's like, it's like, to me, it's everything. I heard some nurses say like, oh, I became a nurse because they make good, because of the pay. But for me, it had really nothing to do with that.
Calling.
Yeah, absolutely. Like, I really feel like this is what like I'm meant to do. And I love it. And I love just like treating people with like total, utter kindness and just trying to make them feel better when they feel sick. And that makes me feel like I get to make up for the things that I did like in the past,
It's beautiful.
Yeah.
Today's video is sponsored by BetterHelp.
How's it been going since you've been doing therapy for the last couple of months?
Oh, it's been great. I mean, I've done therapy my whole life. I mean, since my 20s, I think I've done therapy on and off throughout. A lot of people look at therapy as like, oh, there's something wrong with you if you're doing therapy. The way I look at it is there's something really healthy and right about you if you're speaking to a therapist, because you're able to, like, we all go through things in our lives that just make things difficult. And if you have someone, especially a professional, to talk about it, it just makes your life better. It just calms things down. Your anxiety, your depression, your anger, they all seem to subside, and that's a really healthy thing. And with BetterHelp, what's great about it is no matter where you are, you can be in Alaska, you can be in the middle of Kentucky, you can be anywhere, and you can connect with a therapist, a professional who's really going to help you out. And we all need it. And sometimes if you're not in New York or LA or San Francisco or Chicago, you're stuck without those options. But now everyone has that at their disposal. And you can do this all from your phone or computer, just a phone call, a video chat, or messaging, however you feel most comfortable. It's the easiest possible way to start talking to a therapist. You'll be matched with a therapist usually within 48 hours, and you can get started right away. So let BetterHelp connect you with a therapist, all from the comfort of your own home. Visit betterhelp.com/soft white underbelly or choose soft white underbelly when you sign up and get a special discount on your first month. And now back to the video. And you're working at one hospital? Or you told me you work at multiple.
So I'm a registry nurse, actually. So I work for a staffing company, and they send me out to different hospitals. But that was mostly in the beginning, because when you start to work at a hospital and they like you and they see that you can do a good job, they'll ask you to come back. Can you come back? Can you come back? So during COVID, the particular hospital that I'm working at now, they apparently liked me, and they, wanted to contract with me. So they would say, can we contract with you so that we have you on the schedule for this set amount of time? And then I just stayed there because I liked it. But, technically I don't really work for them. I work for the agency. So it gives me a little bit more freedom. Like if I want to take a vacation, I can say, I'm not available, like stuff like that. Is like if the regular staff, they have to request time off and stuff. So
tell me about your experience with COVID.
Oh my God, COVID was like crazy. It just kind of came out of nowhere. It was like so fast. People were getting so sick. And like I worked in the ICU. So, like most of our patients didn't make it. Like if they got to the point where they had to be on a ventilator, like, it wasn't, a great situation. And, and it wasn't something that happened fast either. It's like these situations where it had like a grim outlook, but it went on for months, where people were getting sicker and sicker, and we're doing all these things to kind of interrupt like death from happening, basically. But like eventually, like most people didn't make it out of the ICU. At least the patients that I had. There were some, but I mean, they weren't walking out by any means. You know, they were leaving with a trach or, you know, things like that. So, yeah. So COVID was rough. It was a lot. But you know, like I feel like sort of like my things that I've dealt with in the past, like that made me kind of tough, like allowed me to be able to get through that without getting too emotionally involved. Or I felt like, okay, I'm the right person to be here at this time because I care about these people, but it's like, it wasn't like I wasn't going home and like, you know, it wasn't destroying me when I would go home. But I knew that like, you know, I had to be there for them and do the job that I was doing. You know, it's like to the best that I could, to the best of my ability, you know, kind of thing.
Yeah.
Yeah.
And then now that COVID is for the most part over, what kind of things do you see? Your ICU?
So I do ICU. Actually, the hospital that I work at, I actually work in every department. They've even had me like working as a charge nurse recently, and I was like, I felt like I had the biggest imposter syndrome because I was like, me, a charge nurse? It felt so weird, you know. But I work ICU. I do ER. I also do telemetry, which is patients on heart monitors. So you know, now I see a lot. Honestly, what I see a lot in the emergency room is chest pain and stomach pain. And the people come in and they have chest pain, stomach pain, and they don't find anything wrong. And to me, like, I'm not a doctor, but like, a lot of it I think is mental. Like I've really got to see that like a lot of our like health and the things that show physical signs start out, you know, with mental, you know, where like you really can mentally make yourself sick.
Yeah. I think so many people are mentally off.
Yeah. Yes. And like, and the thing is like, it's almost, I don't want to say the doctors aren't recognizing, but it's like, there's nothing they can do in the ER for that. Do you know what I mean? Because it's like emergency care. So you have stomach pain. Okay. We didn't find anything. Okay. Sorry. Go to your primary doctor now. You know what I mean? And so it's like, if they don't follow up or go to get, you know, psychiatric or whatever, some kind of therapy, something, then, you know, we can't really do anything about that. That's on them after, you know, they leave the ER and we told them, oh, sorry, we didn't find anything for your stomach pain or your palpitations, you know. Sort of thing. So, you know, what I've been doing recently is that I've been like teaching people like meditation, like in the, like where if they come in and they're like, I'm having palpitation, I'm like, are you anxious? You know, and a lot of 99% of the time they'll say, yes, I feel anxious most of the time. And I'll say, okay, this is what I want you to do. When you're feeling anxious, I want you to stop and like just say, okay, I'm okay, everything's okay. And then you're just gonna do this thing, it takes 2 minutes, and you're gonna stop and you're gonna go from the top of your head to the bottom of your feet, and you're gonna just relax all your muscles. Like I relax my forehead, my eyebrows, my eyelids, you know, till you get to the tip of your toes, and I guarantee you're gonna feel 100% better after you do that. Because I do that, you know, we're like, I remember like for the longest time people would be like, meditation. I was like, meditation, whatever, okay, come on. But I swear to God, it works. That and like gratitude, that's like really what's like got me, like, you know, helps me the most. And so I tell people this, and it's just the light that comes on in their eyes sometimes, and they're just like, oh, I never even thought of doing that, you know? So, I mean, I don't know if they go home and do it or not, but it makes me feel better that I can at least like give them an option that they could try, and maybe if they do, you know, maybe it could be helpful to them. I don't know.
I'm sure it probably helps in many cases.
I would hope so, you know, because I know it works, you know what I mean? I do know that it works. You know, of course, there's things that people come in that they're obviously genuinely sick. Like, you know, older people get a lot of UTIs. Like that's beyond, I mean, I'm not thinking your way into a UTI, you know, it's like beyond your control. But a lot of the things that have to do with like, you know, chest pain and like palpitations and stomach is a big one that's like a lot of mental stuff, you know, like anxiety causes, you know, stomach upset, causes your heart to beat faster, you know, kind of thing. So, and, you know, I feel bad for these people because they come in and they feel like something is wrong with me. And then they do all these tests and then they're saying, no, everything's normal. Like, we didn't find anything. And they're like, but I feel sick. Something feels wrong. I have pain. I have back, you know, I have this pain in my back and you're telling me I don't, you know, you can't see anything. And it's frustrating to them. And it's frustrating to me too, because I want to help them, but like, we don't have an answer, you know, most of the time. So, you know, it is what it is. I think that a lot of people now are using the emergency room for primary care, which is like, you know, I think they just don't know. But, you know, we always try to guide them when they come to the emergency room for something that's like that. Like, okay, you need to follow up with your primary doctor, because if you do have something going on that we weren't able to figure out here, your primary doctor can refer you to, can get you further testing that may be able to look into it further. You know, we're only doing things in the emergency room that's like, you know, something that's, are you going to die right now? Like, we're trying to, you know, make sure that you're not going to die, basically, you know, or help you to not be like really ill. Like if you're septic, you know, we're going to help you, like we're going to give you antibiotics and IV fluids and things like that. But, you know, when they come in with these things that we can't diagnose or don't show anything on a test, there's really nothing we could do, So it's hard. So, we always try to push the, follow with primary care. But, still I think people, because of like, Obamacare and stuff, like anybody, before it cost a lot of money to go to the ER, I remember when I used to go, I was like, oh crap, I'm going to get a huge bill now, but, it's not like, so people can go, sometimes I see people coming in multiple times a month for the same thing. My stomach hurts, I'm having chest pain, and nothing every time, so it's just, it's hard. Like our healthcare system needs work. And I think that like, I sort of wish that some of the naturopathic like things would kind of like come into play, like, because I see a lot of like benefit to a lot of that stuff, and especially like mental wellness and things like, overall health, rather than just like, like fixing like zoning in on a problem and like giving medication to fix that and like putting a Band-Aid on it. But, I'm only one nurse, I can't, so I just do the best I can.
What do you think the biggest problem is with our current health system in the U.S.?
I think it's a lack of having like a lack of seeing that a lot of the stuff is mental, and then like having the resources or kind of making sure that people understand that, going to the ER is not the route to get that kind of care, or like that's not going to help your problem right now. Also too, like, preventative stuff, like, obviously diet and wellness and things like that. But, I've smoked cigarettes for the longest time. People would tell me, still shouldn't smoke. It's bad for your health. And I'd see how, it's bad. No, it's bad for my health, but I still did it, until I was ready to not do it anymore, So those are hard things too, but I think there's a lot of things that, I think that modern medicine needs some tweaking, I think. I think that there's some things that could probably be changed, but there's a curriculum that the doctors are taught, and that's what they're taught, and that's what they know, and that's how they treat, kind of thing.
It seems like there's so many medications that are doled out now.
That's the thing for everything. So rather than, okay, what is the core problem?
Yeah, rather than figuring.
You know what I mean? We're going to put a
causing
Band-Aid on the symptom. We're going to give you medication for the symptom, and then we're going to give you medication for the side effects of that medication, kind of thing.
Yeah, rather than addressing the cause.
Yeah, exactly. Yeah, which a lot of times, like I said, the cause could be something like mental. In the beginning, but. Not always, of course, I can't say that, but like, but still, like, so, it's hard, but at the same time, I just try to do the best I can. And I just try to like give them my full attention and listen and be compassionate and not judge anybody and treat everybody like a human being, like they deserve to be treated. And so I feel like that, if that just helps a little bit for each person, then I feel like I did my part.
Mm-hmm. Are there certain cases that you've seen over the years that are memorable? Certain patients?
I mean, yeah, I definitely have, there are certain patients that will like, I call them magical moments that you have. Like when people were on the ventilators, they can't talk, but, they're alert, you can only sedate them for so long. If they're on a ventilator for, a month or whatever, eventually you can't keep continuing to use that sedation, so they eventually are laying their wake on the ventilator, like, and they can't talk and they can't communicate. But I learned to kind of communicate with people without having to talk. Like I'll ask yes or no questions to get through, like, are you uncomfortable? Are you in pain? And a lot of times I'll try to start talking, like, no. You have to just answer me yes or no. And so I think for me, like when I see that person, that connection happens where they know that they can trust me to not leave them uncomfortable or leave them in pain, that I'm going to sit there in the room and try to as long as it takes to figure out what's going on with them before I walk out. To me, that's like, those are the moments that I remember that feel like the most magical to me. It's like that connect, like that, you're looking at them right in the eye and they finally like, because they don't trust you at first. They think, oh crap, this nurse, they're busy. They don't know, like I'm dying over here and this person's coming, I can't speak, And when they look at you and you look back at them and you let them know, like, I'm not going to leave you until I figure out what's wrong right now. Like there's like something that happens between you and them that just feels to me like magic. I don't know.
It's nice that your work it sounds like it's very fulfilling.
So much. I can't even tell, like, so much. Like, I'm so grateful, like, for where I am right now. Because when I was, doing what I was doing and doing drugs and stuff, I got arrested. So I have a criminal record. I even went to prison. And so I'm not supposed to really be here. You know what I mean? Like, I had to get my record expunged. It took a lot of work and I had to have an investigator, like, investigate me and do all these things. So, technically I could say, if they ask, have you been convicted of anything on a job application, I could say no. But for my nursing license, when it went to the Board of Registered Nursing, I went to nursing school, I knew that I had to explain everything. And so I knew that they were going to look at it and either say yes or no. And so I remember people saying to me, are you sure you want to waste your time doing that? Because they're probably going to deny you. And I was like, okay, watch me. My old attitude again, okay, you don't want to watch me. And so I did. But the crazy thing was that after I graduated from school, all the students in my class took their exam and they got their license in 2 weeks, and it took 8 months for them to approve my license. So I was sitting waiting because it had to go to a review through the Board of Registered Nursing. And I knew it was going to be okay because I had been an EMT for so long, and I had shown, that I was working towards changing in my life, and I had done all these things. I couldn't imagine why they wouldn't, you know what I mean? But you never know. They could have said no. I could have got the wrong examiner or whatever, and she had a bad day and she could have been like, nope, you know what I mean? But it wasn't but they approved it. And so every day that I go to work, I'm so grateful that I get the opportunity to do what I do,
Yeah. What would you say is your greatest strength that helps you with being a nurse?
Now I see my compassion, because I genuinely I know now I'm genuinely a good human being. I don't always.
But you didn't feel that way about yourself.
No, before no, and it wasn't like a parade that came down the street. The day that I crossed the line over into that territory of being good. It was just this quiet moment that I felt okay, I'm here now. I know I'm a good human being. I don't always follow the rules, but I always do the right thing. That's how I live. It's always just do the right thing, and you'll be okay. And then no one can say a bad thing about me at work. I maybe, if they're whatever, but there's nothing that anybody could say that's bad about me. I've never done anything wrong. I don't do things. I don't try to cheat this or not do that or what I do. I fall, whatever you're supposed to do, I do it, and I just make sure that whatever I'm doing is the right thing for my patient.
That's wonderful. Do you have kids?
No.
No kids?
Yeah. I have 2 dogs.
Those are your kids?
Yeah, my babies, yeah.
What are your regrets in life?
I don't really have any now, honestly. I feel if you asked me that a while ago, I would have said, starting out my life the way I did by doing, I should have went to college right out of high school, and why did I blow that opportunity and all this? But I sort of feel everything happens for a reason, so I don't really.
Sometimes the mistakes we make.
Absolutely. I feel all that I had from that time, helps me be better now. Because it allows me to be more compassionate for people. Because I understand if someone comes and they're like me. People used to tell me, you have a chip on your shoulder. And I'd be like, what does that mean? I don't even know what that means. I had no idea. I just didn't understand what that meant. And now when I see someone that has a chip on their shoulder, I'm like, okay, I get it. It's a flaw. It's a flaw. It really is. But at the same time, they obviously don't know, because they haven't got to the place where they have got the self-awareness to realize that they are like that to change or whatever. But so I treat that person with just as much kindness as I would treat somebody that, is not yelling at me and calling me a bitch, you know what I mean, or whatever. I treat them with the same amount of love as the person that's thanking me and, being very sweet.
The world would be a beautiful place if we all had more of that.
I think so, but but at the same time, I think, not everybody, sometimes you don't know until you know. There's been so many times in my life where you figure something out and you're like, oh my God. That's so duh, but you don't know until you know. You don't have self-awareness until you have self-awareness. So, it takes a little bit of practice and being mindful of how you act and how, it's of course, you say you're not supposed to care about what other people think about you. I get that. But at the same time, you don't want to just bulldoze your way through life where you're not, taking into account other people, how it's affecting them, So I think a lot of people just don't have the self-awareness of how they act affects other people, really. They're just sort of oh, it's my life, I do me, But it's well, there's people around you too, so.
As an ER nurse, you've got to see some crazy things.
I do, yeah. Well, I don't work in a trauma ER, so it's it's medical stuff, but, we've have some people that, come in that are living on the street, and, you see some things that it's their situation has got really bad, and you're just how does this even, in your mind, you're you can't even imagine how it could get that bad for them.
It's amazing how we've allowed some of our society
to get, like, yeah,
so low.
to be living in the bushes covered in bugs, you know what I mean? Or with sores all over your body, you know? And they, you know, like come in the air and they treat them like medically so that they're not dying, you know, and they're stable, and then they send them out. You know, a lot of times they'll find people placement, but they, you know, sometimes people don't stay because they don't want to be wherever that is. They're more comfortable where, you know, they were. And a lot of it's mental illness, I think, you know, because I mean, I say like, you know, 95% of it's like people that are mentally ill that really get that bad.
Areas like Skid Row and other cities, Long Beach, I'm sure everywhere has it. It's like an open air insane asylum.
Yeah, exactly. Yeah,
It's like they've closed the mental hospitals, and those people are just on the streets.
On the street, yeah, and it's sad. It's really sad. You know, luckily in Long Beach, like they're pretty tame. Like the ones they're like I have regulars around my building, and I know all of them. They know me by face. Like the one guy, he took a dump on the wall by my building, and I give him money for breakfast all the time, and he knows I live there. So I went outside and I was like, "Hey, buddy," like, "You know me, right?" And he's like, "Yeah, you live right there." And I was like, "Yeah, right. I buy you breakfast every morning, right?" He's like, "Yeah." And I'm like, "So why would you take a dump on the wall where I live?" I'm like, "This is my house." You know what I mean? I'm like, "I live here." I'm like, "I don't appreciate that." I'm like, "I thought we were friends." You know what I mean? Like, I thought like that we should respect each other. I said, you know, just because you live on the street doesn't mean you don't have any self-respect or for the people around you. I said, you know, when your stomach starts to get upset, you can walk yourself down to the beach and take a dump in the toilet like a human being and wash your hands in the sink and you brush your teeth. You know, and he like, it was one of those other situations where he was like, I'm like, I could see the lights going on. Like that had never like occurred to him. And so I said, you know, when I walk my dogs and I take a dump on somebody's lawn, I said, I take a bag and I put my hand in the bag and I pick it up and I turn it inside out and I tie a knot and I throw it in the trash. And he was like, I was like, I'm gonna give you an entire roll of bags. I said, if you have an emergency, I said, I want you to go down to the beach first, but I said, if you have an emergency, you know what I mean? You gotta pick it up. Just pick it up and throw it in the garbage. And I was like, please do that. And I'm like, and I'm gonna ask you right now to clean up what you left on my building or we're not gonna be friends anymore. You know what I mean? You wanna act like a cockroach, like cockroaches get exterminated. You know what I mean? Like, I'm not here screaming at you, telling you to get off my sidewalk. I'm like, oh, hi, good morning. Are you hungry? You know, I said, we're not gonna have that kind of relationship anymore if you're gonna treat me like this. And so, you know, he didn't. He picked it up, you know? And so I haven't seen any dumps on the wall since then. I mean, I'm sure somebody else will come along and do it, but like, at least not from him, you know what I mean? Like, but like at the same time, I don't think it even occurred to him. He's like, I have to go to the bathroom. There's a wall right there. He wasn't thinking about me or whatever. He's just like, I have to use the bathroom. That's like a place to do it where you know, I'm kind of hidden or whatever. You know, so like I feel like there was like a teaching moment, you know, for this guy. Like he just didn't realize he wasn't thinking. He didn't have any self-awareness. Like, and maybe now when that happens, he'll like think about it. I'm not saying that it's going to stop him from every time from whatever, but at least he'll have me in the back of his mind going like, wait a minute, that's not nice. Don't do that, you know, or whatever. So, you know, but there's a lot of that, you know, and it's sad because like, you know, it's sad because this person is a human being and they don't even have a toilet that they could use to use the restroom to wash their hands, you know, or like things like that.
Or
you know?
a roof over their heads.
Yeah, exactly. Yeah. So, or close to, you know, or I see people too where like they crap their pants and they're just walking around with pants that they crap because they don't have a pair of pants to change. You know, I'm always constantly giving out clothes all the time. You know, like I have like clothes that I have in my closet that are just for giving away to people that like, you know, when I see them, like, okay, do you need like something to change? Like, you know, because that makes me feel good. You know, I don't know if it's like I do it selfishly, like I said, like because that makes me feel good to do that for you. You know what I mean? Like whether or not like you're that happy at the end of the day because I gave you a clean T-shirt, like it makes me feel good. So I do it selfishly.
It would be great if more of us understood that doing things for others is ultimately
it makes you feel really good.
About yourself.
Absolutely, and that's, you know, it's crazy.
And it can take away the anger. It can take away the shame. It can take away a lot.
Because the old me would have went out there and been screaming at that guy. Probably would have hosed him down with water or something. Who the fuck are you? Don't you shitting on my wall? You know. But I was just like, listen, like that's not okay. Like please don't do that. Like let's have respect for each other. You know, like that's like the person that I am now. Like I don't speak to people that way anymore where I yell at them and tell them they're a piece of shit or whatever, you know, because like whatever I think, it's not my business. It's not for me to say that, you know, so I just try to treat everybody with respect no matter what they are or who they are doing or whatever, you know, I don't know.
Does your work take a toll on you emotionally?
No. Yeah, no.
Didn't take you long to answer that.
Yeah, no, because I feel like I have tough skin. So like I I don't let it do, because why? What good does that do? What good is that going to do if I go home and cry about somebody that didn't make it or whatever? It's not doing them any good. You know what I mean? It does the patients better if I can show up to work and do my job and be 100% mentally there, rather than, feeling sorry for the person that died yesterday or whatever. So that's kind of how I look at that.
You need to have that kind of, that thick skin
I think so, yeah.
to do that kind of job.
I think so. Yeah, I mean, I heard a lot, I'm not to judge anybody, and this is just for me, but like there was a lot of nurses that were like, after COVID, I'm having PTSD, and I understand that's a real thing, but like, for me, it's just like, why do you allow that to happen to yourself? Like that's a choice, you're choosing to like feel that way in a sense. I kind of feel like, or for me, it was like, it's a choice to feel that way. Like I could go home and cry about it. I could let it affect me. I could get sad. There's lots of people I could get sad over because it's sad. It sucks. You know what I mean? Like seeing somebody dying of cancer that's really young and probably could have, has a husband that's really, and kids that are there. You know what I mean? Like I could go home and cry about that, but it's like, it's not doing anybody any good. So I just try to, show up and be 100% so that I can be there to help the next person while they're dying of cancer or whatever, you know what I mean?
And Rachel, what would you say is the most important lesson you've learned in your life?
Everyone deserves to be treated with respect, no matter like who you are and what you've done. Because like everyone has a reason why they are the way they are, and it's not for me to judge, and I don't even know. I don't know what happened to you that made you like that, And so I think that everyone can change, and I think everyone deserves a second chance, sometimes even a third chance, Because I had many chances along the way that I, fucked off, So, but people, for whatever reason, kept believing in me, and I kept believing in myself. I don't know, So I think everyone deserves respect, no matter what.
Beautiful.
Yeah.
Rachel, thanks so much for sharing your story.
For sure, yeah, absolutely. Thank you.
I wish you lots of luck.
Even though Soft White Underbelly consists of a lot of videos, it's really still a photography project to me. And if you appreciate the photography, sometimes it's difficult to enjoy it when it's scrolling down the screen, which is the only option I had in this horizontal format on YouTube. So last year we came out with the first Soft White Underbelly book, which is a collection of the best portraits from the thousands of interviews I've done. Each portrait in this book is accompanied by an interesting quote from the person's interview.
Oh my God.
There's more.
Wow. These aren't as bad as I thought. I look like a witch.
The book includes multi-page spreads of both Rebecca and the Whitaker family. I will not be reprinting this book when it sells out, so once it's gone for good. You can order yours at softwhiteunderbelly.org. $125, $150 for a signed copy. And thank you for watching.